Good day, my name is Jean Wyman, and on behalf of the Prevention of Lower Urinary Tract Symptoms Research Consortium, I will be presenting on our study on the normal reference ranges for daytime and nighttime urinations in healthy women. I have nothing to disclose. Currently, there are no established normal reference ranges of urination frequencies in healthy women. Most of what is known is based on studies of women with lower urinary tract symptoms. We published a meta-analysis that found wide heterogeneity in estimates of urination frequencies, with analyses limited by different criteria for defining healthy women and failure to adjust for potential covariates that could affect bladder function, such as demographic characteristics, fluid intake, and medical comorbidities. To address these limitations, this study aimed to estimate normal reference ranges for daytime and nighttime urinations based on two definitions of healthy women, and to examine differences by age, race, ethnicity, and fluid intake. We conducted a secondary analysis of the first follow-up interview from women ages 31 to 87 years from the Boston Area Community Health Survey. This survey was a population-based longitudinal study of community-dwelling adults residing in Boston, Massachusetts. We used eligibility criteria that varied in their strictness. Healthy women needed to be non-pregnant, free of urologic abnormalities, urinary incontinence, and other bladder diagnoses, not report a bladder problem that was more than minor, not use LUTS medications, have a catheter, or have a progressive neurologic disease. Additional exclusions for the elite healthy subgroup required them to be in good or excellent health with no LUTS or bladder problems, no previous incontinence treatment or surgery, use of pads, have any medications or comorbidities that could affect bladder function, and not be limited a lot in their activities. The elite healthy group was younger than the healthy group, with more women in the 31 to 44 year age group and less women in the 65 plus age group. Race, ethnicity, and fluid intake levels were similar. Daytime frequencies were similar between healthy and elite healthy women overall, by age, race, and fluid intake, whereas there was a much wider variation in nighttime urinations. Normal reference range for elite healthy women were up to 9 voids per day and up to 2 voids per night. For healthy women, daytime voids were up to 10 per day, with nighttime voids up to 4 per night. We ran regression analysis controlling for variables that showed a significant bivariate association with urinations. These included fluid intake, age, race, BMI, hormonal status, smoke status, sleep problems, depression, anxiety, cardiovascular disease, hypertension, diabetes, and joint problems. This slide illustrates the analysis in the elite healthy group and shows that elite healthy women who were Black or drank less than daily fluid intake had significantly fewer daytime urinations, but there are no effects based on age or large fluid intakes. For nighttime urinations, there was no significant effects by race, ethnicity, whereas there was a trend toward significance for women who were age 45 to 64, and for those who drank the majority of their fluids after 5 p.m. or drank more than the daily recommended fluid intake, having fewer nighttime urinations. In conclusion, there's a wide variation in what is considered normal daytime and nighttime urinations in healthy women. However, there are some significant differences by race, but not age. Other than low fluid intake leading to fewer daytime urinations, fluid intake tends to have a minimal effect on daytime and nighttime urinations in women with healthy bladders. These findings can be used by women and clinicians in interpreting urination frequencies that indicate normal bladder function, and we recommend that future research examine factors that affect that upper bound of the reference range for urination frequencies. I would like to acknowledge the listed investigators and centers and the National Institute of Health for funding this study.